ng hot compress doon sa edema. Okay, yung manas. Okay, kasi may manas daw yung tatay. Kasi may problem sa kidney. Kapag ganun po, hindi po siya nare-relieve ng hot compress. Di ba nag-hot compress tayo to relieve yung inflammation. So, yun kasi is hindi siya inflamed. Kumbaga, manas because of hindi na ilalabas yung tubig sa katawan kasi failure yung kidney ng pasyente. So, ang pwede lang makapagpa-impis doon is through dialysis. So, sabi ko hindi po nag-a-apply. Nag-a-apply lang tayo ng hot compress is kapag inflamed. Like for example, yung IV site ng pasyente mo is maga. So, you need to apply hot compress para mabawasan yung fluid, yung excess fluid doon sa tissues na yon. So, yun ha, magkaiba ha. Baka kasi pag sinabi mong edema, maglagay tayo ng hot compress. Di ba minsan ang ginagawa natin para ma-relieve or ma-lessen yung edema ng pasyente is we need to instruct the patient na erase yung paa. Di ba? Ganon yun. So, magkaiba po yun. So, this is the systematic effects of heat. So, heat applied on large body area. Kapag heat applied ka, nagkakaroon siya ng excessive peripheral vasodilation. So, ibig sabihin nun, lumuluwag. And then, kapag lumuwag yan, ito yung natural effect ng vasodilation. Nagda-drop yung blood pressure ng patient. Kapag nagkaroon ng dropping ng blood pressure, syempre po, anong mangyayari? Nagkakaroon ng fainting attack. So you need to observe yung pasyente kapag nagbibigay ka or nag-a-apply ka ng heat application. Kasi baka mag-hypotensive ang pasyente mo. Diba? Baka mag-palpatory ang pasyente mo. Ma'am, ano yung palpatory? Ibig sabihin, hindi mo na naririnig yung diastolic ng blood pressure. Like for example, 60 palpatory, ma'am, wala na akong maririnig dun sa diastolic. Di ba, ang normal blood pressure is 120/80. Kung sinabi mong 90/60, yung 60, that is the diastolic. Pero kung di mo na naririnig during the taking ng BP mo, that is palpatory. So magkakaroon ng fainting attack ang pasyente. So observe nyo din ha kapag nagkaroon ng excessive peripheral vasodilation. Okay? Then, persons at risk, so fair skin, people with problems sensing pain. Ayan, person with metal implants. Ito yung mga metal implants na to is ang pasyenteng nag-undergo ng hip replacement, yung ORIF or the open reduction internal fixation. Naglagay sila ng implants like yung plates or yung screw. Yung mga fractured patient, di ba? Para maayos yung mismong fracture, di ba? Meron tayong tinatawag na comminuted or complete fracture. So naglalagay sila, nag-i-implant sila ng bakal sa loob para makorek. Okay? Yung mismong fracture. And then very young, elderly, changes in skin with aging. Those with dementia might miss pain kasi nga may sedative effect po kapag nag-apply ka ng heat. Okay? The next is applying heat and cold. So, kapag heat, nag-apply ka ng heat, nagkakaroon ng moist. Okay? And then kapag dry naman, di ba, cold. Like for example, kapag ikaw is malamig yung panahon, pag Christmas, di ba nagda-dry yung skin natin? So, mag-apply ka ngayon ng agent para mag-moist. Okay? So, next is we have the moist heat application. So, water in contact with the skin. So, nagmo-moist po siya with contact sa skin directly. So, as you can see po sa picture. So, binababad siya doon sa may palanggana na may water. And then, water conducts heat, has faster effects than dry. It penetrates better. Diba? So, meron tayo ng hot compresses using the bag and the bottle. Ayan, yung binababad, yung uupo ka doon sa may bedside commode or yung timba, yun yung sitz bath. Okay? Kasi yung mismong usok nun or yung mismong, di ba, kapag mainit na mainit, yung mismong moist nun is pumapasok. So, marerelieve po yung pasyente. Lalo na kapag inflame yung area na pinag-applyan mo. Okay? So, yan, ginagamit yon sa mga normal spontaneous delivery na nagkaroon ng episiotomy or laceration na tinahi. Kasi syempre, pag may tahi, inflame. So para ma-reduce yung inflammation, so yun, advise the patient na mag-hot seats bath. Or meron din kaming ginagamit sa ward, yung tinatawag na Perilife. So itututok mo doon sa may perineal area ng pasyente para ma-minimize yung inflammation for 30 minutes. 30 minutes lang ha, huwag masyadong dikit kasi mainit din po yun. And then tatakpan mo ng blanket. So make sure na balikan mo yun na pag hindi mo binalikan, masusunog yung puwerta ng pasyente mo. Magbe-burn. Okay? And then this advantage of heat application is nagkakaroon ng increase capillary permeability. Kapag nagkaroon ng increase ng capillary permeability, yung extracellular fluid mo, okay, pupunta doon sa capillary walls, which is, ang cause nun is, or ang end point nun is, magkakaroon ng edema ang pasyente kapag increases. So this is the disadvantage of heat application. Kaya kailangan i-assess and observe during yung pag-a-apply po. Okay? And then local effect of cold, so lowers the temperature of the skin and underlying tissues. Yes, di ba? Pero ha, kapag nag-a-apply kayo ng cold, for example, pwede po ba kayang ang pasyente namin is applyan namin ng cold kapag mataas ang lagnat? Wag. Dapat yung galing lang sa gripo. Okay? Ano ba ang magiging effect nun? Mag-shiver po ang pasyente. Okay? And then, vasoconstriction. Decrease capillary permeability, and then slow bacterial growth, decrease inflammation, and then local anesthetic effect. Same lang doon sa ating hot application. But sa hot application, may vasodilatation. Pag ito naman, vasoconstriction. Like yung sinasabi ko kanina, kapag yung infant, pinaliguan mo siya, kailangan mabilis lang. Kasi magkaroon ng vasoconstriction. Lalamigin, magiging cyanotic yung pasyente mo. So magiging decrease yung kanyang oxygen level. So kailangan bigyan mo ng oxygen pag gano'n. Pag napansin mo, medyo cyanotic siya. Okay? Nagiging purple na yung paa, yung lips, and then yung palm niya. Okay? And then, the systemic effect of cold, so excessive cold application, magkakaroon ng vasoconstriction. Kapag nagkaroon ng vasoconstriction, it increases of blood pressure. Pag vasodilatation, decreases blood pressure. Kapag vasoconstriction, it increases yung blood pressure pag excessive cold application. And then, prolonged cold can cause shivering. Okay, so magsishiver yung pasyente nyo. Giginawin, okay, lalamigin. And then cold application complications, so pain, burns, and blister, and then cyanosis. Persons at risk, fair skin, yan, those with mental or sensory alteration, and then high risk for elderly or very young individuals. The next is contraindication to use of heat. So the first 24 hours after traumatic injury. So hindi ka dapat maglalagay the first 24 hours. It increases bleeding and swelling. Okay ha? Contraindication. First 24 hours, never ever kang maglalagay ng heat application kasi it increases bleeding and swelling. And then active hemorrhage, heat causes vasodilatation and increases bleeding. Yes. Diba? Kasi dilated yung blood vessel mo. So, active kasi yung hemorrhage. So, it can increase yung bleeding. Diba? And then, non-inflammatory edema. So, ayan, non-inflammatory edema. Ito yung kaninang sinasabi ko na may edema yung pasyente or manas because of hindi nag-filter yung kidney or nag-malfunction yung kidney mo. Then, heat increase capillary permeability and edema. Okay? Skin disorder, heat can burn or cause further damage to the skin, and then localize malignant tumor. It increases cell growth and accelerate metastasis. Ito naman kapag ang pasyente mo naman is may cardiac or cancer cells. So wala pa naman tayo doon. Kaya you need to observe na lang kasi contraindicated sa mga pasyente na may cancer cell ang heat use. Then contraindication to the use of cold. So open wound, cold can increase tissue damage. by decreasing yung blood flow to an open wound. So huwag kang maglalagay ng cold sa open wound. It can increase yung tissue damage. Okay? Decrease yung blood flow. Decrease yung blood circulation. Okay? Impaired circulation, ayan na nga, cold can further impair nourishment of the tissues. Okay? And then allergy and hypersensitivity to cold application. Yes. Minsan kapag malamig, di ba, nagkakaroon kayo ng allergic rhinitis kasi sobrang lamig eh. Okay? And then some people react by decreased BP kasi nga vasoconstricted. And then inflammatory response, swelling, joint pain. So these are the contraindication na wag sa paggamit ng cold application. Then, so same lang po ito. So contraindication to use heat and cold. So after 24 hours traumatic injury, active hemorrhage, non-inflammatory edema, localized malignant tumor, skin disorder, open wound, and allergic or hypersensitivity to cold. Okay? Contraindication to heat and cold, same pa rin siya. Neurosensory impairment, ito yung kanina, yung may impaired mental status, ayan. And then immediately after injury or surgery, impaired circulation and open wound. Okay, so these are the temperature for hot and cold application. So description, pag very cold, ang temperature niya is below 15 degrees. Okay, ice bag ang application. Pag sinabing cold, it is 15 to 18 degrees. Pag sinabi namang cool, so 18 to 27 degrees. Ito yung kadalasan natin ginagamit, cold compress. Pag tepid or TSB, tepid sponge bath, 27 to 37 degrees. Ito yung siguro kinukuha natin sa sink, okay? Doon sa gripo, okay? Yung running water. Pero huwag tayong maglalagay ng alcohol ha kapag nag-sponge tayo sa pasyenteng may lagnat. Ano bang effect nun? Di ba? Lalamigin ng pasyente mo lalo. And then warm, 37 to 40 degrees, warm bath. And then hot is 40 to 46 degrees. So ito po yung hot compress, yung sinusok natin yung directly, okay, sa pasyente or dun sa ibababad natin. And then very hot is 46 degrees Celsius, hot water bag for adult. Ayan. Then methods of applying heat and cold. So hot water bag, so pwede nating hot water bag or yung bottle. So more common source of dry heat, inexpensive, improper use leads to burning. Okay? So po pwede din po yun. Okay? Pwedeng mag-lead sa burn kapag improper use yung pag nag-apply ka. And then hot and cold packs, commercially prepared hot and cold packs provide heat or cold for a designated time. So may ano naman na yan, prepared na siya. Meron din yung, di ba nabibili natin sa SM, yung sinasaksak na lang siya. Kaya lang parang minsan nakakatakot kasi baka mag-leak doon sa may opening area, doon sa cup niya. And then electrical pads, so provide constant heat or lightweight. Some have water-proof covers to place over a moist dressing. And then ice bags, ayan, filled either with ice chips, and then compresses can be either warm or cold, and or moist gauze dressing applied to a wound. Then, ayan. So, yung binababad natin yung pasyente with the solution. So, yung mismong body parts ng patient. And itong sinasabing sterile surgical or sterile technique is generally indicated for open wound is meron yan guys during open surgery or yung tinatawag natin na exploratory laparotomy, gastrectomy, di ba? Humihingi po yung surgeon ng warm water. Pero hindi dapat mas mataas doon sa warm water yung temperature ha kasi baka malapnos yung mga internal organ. Okay? Kaya naman sila humihingi nun is to prevent yung inflammation. Okay? And para malinis yung surgical site. Okay? So making sure na warm lang po siya, hindi po siya yung hot. And then sitz bath or hip bath used to soak client's pelvic area. And then the client sit on the chair and immerse in the solution. So ayan. So para ma-relieve yung pain na nandito sa may hip. And then colon sponge bath, promoting heat loss through conduction, and then accompanied by antipyretic medication. So, ayan po. So, depende kung ano yung order ng doktor. You need to verify the doctor's order, or else kapag nag-apply ka at contraindicated sa pasyente, you are liable. Okay? So, po pwede kang mag-incident report. So, this is the sitz bath. Okay, yung bedside commode. Ito wala tayo dito sa Pilipinas. Yung bedside commode, meron tayo. Yung lagi kasi ang binibigay namin kapag yung pasyente is post-operative sa hemorrhoidectomy. Okay? And then these are the nursing checklists, heat and cold application. So general guidelines to follow when using heat and cold application include obtain physician's order that details the site to be treated, the type of therapy, and frequency and duration of application. Yan. Select temperature on the basis of client status and agency policy. And then thoroughly explain procedure and expected benefits to client. Yes, you need every procedure you need to explain. Okay? Para meron silang time or meron din naman silang karapatan mag-ask ng question about doon sa procedure. Diba? As we all know, meron tayong right ng pasyente. Meron din tayong right sa medication. So, kailangan alam din po nila yon. Kapag yan nag-refuse, wala kang magagawa. Respect yung decisions nila. Okay? And then assess client status before, during, and after treatment is performed to prevent injury. Huwag mong iiwan ang pasyente, lalo na kapag direct contact doon sa HAT application. And then document effects of therapy. Okay? Kung narinig ba ang pasyente mo, kung naging komportable ba yung pasyente mo, so you need to document that. Okay? So question. Any question po? Questions, clarifications, violent reactions, any added information sa ating discussion? Guys, nandyan pa ba kayo? Hello? Hello, hello, hello.
Okay na po, ma'am.
Okay, so ano po, any questions about doon sa ating schedule for quiz and yung date ng ating pagsasubmit? Miss President, message mo ako para mai-set ko doon sa Canvas.
Sige po, ma'am. Thank you po.
Okay, then yung conversation natin kapag meron na kayong date, doon na lang mismo sa GC nyo ha, kasi baka magkahalo-halo na yung information or instruction doon sa GC natin. Kasi hawak pa kayo ni ma'am sa lecture para at least doon lang sa lab. Okay? Okay po ba?